For those of you who I have not seen since the new year started, Happy New Year. Interestingly enough, with a hospital that is on a fiscal year that begins in July, we're always talking about that new year, and we always talk about in July because that's when everything kind of starts for us. And that's when we set the organizational goals for the year. That's when you get all these action plans coming out, and here's what we're going to focus on and all those good things. The leadership team was able to go off-site and kind of spend some time and talk about something a little bit different, which is the new calendar year. It's a time for a fresh start. It's a time for when people make resolutions. But we wanted to do that for the organization, but not come in and completely change the direction and strategy that we put in place, because that was really what we started in July. And when the discussion started of, okay, what are some soft skills or some soft goals that we can really focus on for the calendar year, a unique discussion ensued. And that is that every time, it seems like, and I mean 99.9% of the time, when a visitor comes into this organization and makes their way back to administration or makes their way back to a meeting that they're attending, you know what they say? I was greeted with a smile. You have the friendliest staff. What do you use to clean this place? It smells great. It's clean. And you know, they try and describe this intangible thing of it just seems light here. It's airy. There's no oppression. That's y'all. That's a culture. That's a philosophy that exudes every single day in what you do. And it's being noticed. So when we were having the discussion about what can we focus on, this actually came up. But it came up in a, how can we make sure that we keep doing that? Because, you know, we talk about quality and how we're the #1 hospital in the state of Tennessee when it comes to quality. And now we can differentiate ourselves and we can go market ourselves and we can use that quality, and we're doing things that other people are just trying to figure out, and we've got them down. And there's that idea of, well, the only place if you're at the top that you can go is down, which is not true, right? And we've proven that. When people come in and they're greeted with a smile, walked to where they're supposed to go, it's clean and it smells good. Do you know how quickly, if they walk in the next time and they don't get the smile, or they walk in and there's that dirty cup laying on the floor, or someone spilled something and they get to watch 2 employees step over it, or they're wandering around lost and no one stops and asks them, may I help you? Can we get you to where you go? Do you know how quickly that ultra positive experience that set that expectation, it set the expectation up here. You can disappoint people so quickly from a customer service standpoint if you're not consistent on that. So we identify that. Y'all are knocking it out of the park all day, every day. But we want to make sure that we have that ingrained and forefront in our minds to make sure that we're proud of that. That's a trait that we want to continue, and we want to put things in place to make sure it's there. And so, like all good leadership teams, the first thing he said was, well, let's look at ourselves first. Where can we work to set an example? And then the easiest thing to do is look all the way at the top and say, what can I do? Well, I have this bad habit. You know what my bad habit is? One, I have too many meetings. But I will come out of a meeting and my phone will have been vibrating for the entire time, it seems like. So what's the first thing I do when I step out of that meeting?
Look at your phone.
Look at my phone. Start responding to emails, start responding to text messages, start trying to plan for the next meeting or whatever I have left. And you know where I am when I'm doing this? I'm walking through the hallways, trying to not run into people. I'm not engaging with you. I'm not saying hi because I'm busy, right? Can't do that. Cell phones have become the biggest modern day distraction for everyone.
Preach it.
So what I need to do, start leading by example, and what I would ask all of you to do, in your departments, re-examine your cell phone policy, because we have heard from patients we have heard from visitors, and I have exhibited poor etiquette when it comes to cell phone usage. We're very happy about our Facebook page. I think that you might have noticed, I hope that you've noticed if you follow us on Facebook, that we're getting much better with our updates and putting information on there and being really cool. But it's interesting how many people are here working a shift and are liking our pages, which I want you to do and I want you to share. Y'all are really active on Facebook during the day. So just be aware that when the patients can see you and visitors can see you, and the screens on these phones are getting huge. So visitors can see that you ain't texting Dr. So-and-so about their mom. They can see that you're sitting there probably checking out the latest sale on something because there was a doorbuster sale going on, right? So make sure that within your departments you're examining. Now, cell phones, we're actually using them for contact to physicians and to each other that are appropriate. But if it's not appropriate within your department, make sure you just leave it in your locker, leave it in your pocket, and understand that people can tell and see what you're doing. You can tell by your body expression if you're dealing with a personal text or not, right? So just be aware. The other thing that we need to, again, from a leadership standpoint, and let that resonate down, is understand that we talk all the time about lean and performance improvement and making sure that if we have a problem in the hospital, and that can be just a quality initiative that we're trying to do or just some change that we're trying to do, we've really focused on trying to put an interdisciplinary group of people together who do the work every single day. You know, it used to be we talked about the command and control model, right? I can sit in my office and pretend like I'm the smartest person in the room, and I can come up with an idea and go, you're going to do this because I'm the CEO and I said so. And those never work. Y'all just get really, really good at working around my harebrained idea. But if you get a group of people who do the job every single day, maybe along a service line, get them in a room and say, how can we fix it? What can we do? And empower that group. Then what you're wanting to do is you're wanting to get that feedback, and what we see in this organization is that works. You all have the power to make very, very significant change. We need to start at everyone's level, all the way up to mine, to get rid of the no and the I can't mentality. I need your help because you need to be empowered to realize that there is nothing here that you cannot impact to change. If we are getting in the way of good patient care or good quality, I need you all to make sure that you do not have a no or an I can't mentality, that you get that to the right people, that we set up a group and we get that solved. On my end, I know that there are times to where an idea is presented to me and you get a no or we can't too quickly. And where I fail is to let you know that there were 13 other things that I just went, no, we can't do that because this and this and this, but then I fail to explain it. And so the impression that you get is he discounted it too quickly, he didn't listen, was ready to say no before he thought about it, right? That's what you get, because I'm unwilling to say, well, here's what this is. But if you just simply get the no or the I can't out of your vocabulary, you are forced to give an explanation as to your thought process and your rationale as to why. And then you can have, everyone can walk away with a good informed decision, know what we're doing, and probably be more informed about the overall strategy and direction for that particular thing. So that's the commitment we're making from the leadership standpoint. That's the commitment I need from you all. Don't ignore a problem. Don't sit there and think or tell a patient or tell a visitor or tell a coworker, I can't or we won't. Let's get things fixed. All right? You're going to see stoplight reports coming back out on communication boards. Here's what you're saying. Here's what we're working on. Here's what we can't do now because of budgetary constraints or whatever that works, but you've got a full explanation. That's our commitment to you all. So what I hope, and those are our resolutions for the year. So what I hope you see is that we are not changing the course of the organization. You've got your 12 to 13 organizational goals that have been communicated and are on the communication boards and talked about and discussed. These are just some softer, finer points that we want to focus on for the year, starting from the top and then making sure that it resonates throughout the entire organization. Does that seem doable? Any questions about them? All right, good. Okay, I want to talk briefly about pediatrics. Anybody heard anything in the community going on about pediatric coverage for the hospital? Some people have, some people haven't. All right, let me catch you up to speed on it. Springfield Pediatrics. It's the only pediatric group in our community. They're a great group. They coach soccer teams over at the YMCA. Dr. Ashworth has been here for a very long time, very involved in the community, passionate about what she does. They're an outstanding, high-quality group. They're experiencing the same thing that we experienced when we turned on the electronic health record inside the hospital. And we noticed that all the PCPs left. Then we had a big push for a hospitalist program. Well, why is that? Everyone's using a computer system in their office, and they have to learn a different computer system in the hospital. There's quality scores that are being measured upon in their office. There's quality scores that are being measured upon in the hospital. And I was speaking with Dr. Kumar. Dr. Kumar was in a meeting with all of us yesterday, and he was joking and saying, did you know that even a general surgeon was expected to take emergency department call in the old days? This was in the 70s. And he said when a heart attack patient would come in, they would order Coumadin, stool softener, and put them in a bed and have someone call them in the morning if the patient wasn't better. Okay, now, if you come in with a heart attack, my God, code STEMI, we're off and running. We're trying to hit a 60-minute door-to-balloon time. We're putting you up in the cath lab. Everyone's coming in. We're ordering crazy kind of, no, and it's on film. We're looking for a 60-minute because every minute is cardiac death. So everyone flinched on that one. I raised the bar on you just then. But on a stroke, we want to make sure that we drip within 60 minutes. So you just have all these resources and all these things, and so it requires a whole lot of understanding of the medications that are available in the hospital in terms of our formulary. All the medications are on the outpatient side. Clinic-based practice is totally different now than hospital-based practice. So Springfield Pediatrics said, you know what, we support your program for OB. We support the fact that they are just simply bringing in a lot of volume, which is great. But if you look at the resources inside the hospital that they have inside the hospital to take care of all these babies that are now coming in, if you look at everything that's kind of going on, we're becoming a destination for deliveries, and if you look at the fact that their clinic is increasingly busy, it just makes it to where it's not quite feasible for them to do both. Okay, so they said February 15th, we're not going to be able to provide coverage for the nursery anymore. So we've worked through a process to make sure that we've got well baby and emergency coverage. We're actually kind of killing two birds with one stone on that. We will now. We've worked out a deal with our anesthesia group. All the CRNAs are going to be certified in neonatal resuscitation. In an emergency with a baby, they're going to take control of that child because we're a level 1 nursery. Level 1 nursery is a complete healthy baby. We don't do not healthy babies. They get shipped, right? It's not appropriate for a community hospital to be taking care of that. So really what we're doing is we initiate a call for either Life Flight or Angel ground transport to come in and take that baby. We are holding that child, making sure that they are stable, right? Airway, fluids, we're good. We wait for Angel to come in, they get the child and they go. So during that period of time with an emergency, we're gonna handle that with CRNAs. The good thing about that is that means that we will have anesthesia in-house 24/7, 365, also with a second call team. So anybody that impacts, you understand how important that is, that we haven't really had a firm second call anesthesiologist before. And so we've been able to work that out with them. So we're excited actually about the solution because I think it actually provides a better environment for all those that need anesthesia. Plus we'll have ability to begin looking at inpatient pain services and all these other things that someone from anesthesia being in-house 24/7 can bring. So we're actually excited about that, and I think thanks to Springfield Pediatrics, we'll be able to actually raise the bar quality for the pediatric patients that we serve. So we're excited about it. Any questions about that one? Okay. All right, let's talk about volumes for a second. So I hope y'all have noticed, November, December, and now into January, seen a volume increase. Several things with that. One is we have a new ED group. and they're seeing a whole lot of patients. We got the flu that kicked in. A whole lot of things happened in terms of we're seeing some pretty significant volume coming out of the Clarksville area, so our reputation and our marketing is playing out very well there. Also, the collaboration between the new ED group and the hospitalist, it seems that we're admitting a few more patients and getting a few more patients in the door. Transferring patients less, we have teleneurology turned on now. Interestingly enough, over the course of a year, we may only have 6 stroke patients, but over the course of a month, we've evaluated over 30 patients for stroke-like symptoms. We were pretty aggressive on shipping those patients because we couldn't evaluate was it an actual stroke or was it not. With teleneurology, they're doing the evaluation and going, it's not a stroke, don't worry about it, but you can hold them, you're fine. So we're able to hold more patients, and so we're seeing all of this work, but what it means is y'all are seeing a lot of inpatient volume, plus on the outpatient side, dear Lord, the high deductible plans just compressed everybody into the end of the year with all the outpatient services, so we got to see a lot of volume coming through. And then January it trickled over because all the Medicare patients that we couldn't get in at the end of the year, and we said, you know what, you don't have a deductible, you're going to go to January. So it's worked out pretty well on that, and so we've been able to see a whole lot of volume. So I hope that you're excited about the consistency of your schedules when it comes to that consistent volume, but I do understand too that to have gone from a low volume time to a high volume time without much of a transition in between there gets tough. So it's our job to make sure that we're busy all the time and it's consistent, and then we've got everybody kind of grooved in on it with the right resources. So thanks for going with us on that journey of making sure. And the nice thing is that obviously from a volume standpoint, it translates into good, strong revenue growth and further stability. So hope you've seen it. Hope you're appreciative of it. Sure beats the alternative. Okay. Anybody here remember Night on the Town? We used to have it over at the center. Yeah. All right. Much by popular demand. April 23rd, I believe was the date I wrote down here. April 23rd, Night on the Town is coming back. It'll be held at the center. It's a Denim and Diamonds event. So brush off your cowboy boots and all that good stuff and get ready to do that. But again, we're very happy to bring that back. For those of you who do not know what that is, Night on the Town is a very local community feel. It's a good night in which we've got music and entertainment, silent auction. It's a fundraiser for hospice. But also, it's just a time to get together. It's time to mingle with the community. It's time to mingle with your coworkers. It really is a fun event. So we work typically, if you have a physician in your area, see if they'll sponsor a table and then let a group of you and your friends go. If you have vendors that you work with, tell them they need to get their signage. We give them a lot of opportunity to do some marketing. It's actually when we hit some of the local people around town for sponsorship because they like to get their signs out. So work with people and see if they'll sponsor your table for you. That way you get a free Denim and Diamonds event, right? It's less expensive than the gala. You're not going downtown. It really is that local fun feel, and you're close to home. So if you have too much fun, it's a good, inexpensive taxi ride home. So finally, I'd be remiss if I did not briefly talk about Medicaid expansion, just to simply make sure that we're all on the same page. It's actually not one of my favorite topics, but it does. You are in healthcare. Amazingly, if a healthcare topic comes up in politics, it seems like I'm sure if you're around your family or friends, they assume that since you work in healthcare, you must know everything about all the politics that are driving it. So Governor Haslam has put out a plan called Insure Tennessee. It is a Medicaid expansion plan to impact a little under 200,000 Tennesseans. The plan is a two-pronged plan. One of them is that if you make less than $16,000 a year and work for an employer who provides benefits, there's a voucher system in place. They'll give you a voucher. It essentially offsets the premiums that you would have paid to the employer for that insurance and allows you to participate in their plan. So it'd just be like your company offers Blue Cross Blue Shield and you lined up, or Aetna, or a VHAN product, and you were able to get your premiums waived or paid and be a part of the plan. Now then, you've got people that are still making less than $16,000 a year who do not have the opportunity to participate in an employer-sponsored plan. They fall into the traditional Medicaid bucket. They receive what is essentially a healthcare savings account card. and then they're able to participate in wellness things. Even YMCA gives you points on your card. The points translates into dollars, and you use the dollars to offset your co-pays and out-of-pocket expenses for healthcare. Those are the two things. For this county, it's anywhere from 2,000 to 4,000 people would potentially fall into the plan. There's no risk to the Tennessee taxpayers because the hospitals have said, you know what, those patients are going to come to us anyway. Right now, they're not eligible for Medicaid. They may not be eligible for charity care. They make less than $16,000 a year. They're not going to be able to pay their medical bills. Therefore, we're going to be providing a free service to them anyway. It would be better for us to get something. So we would say that if it's going to come down to a taxpayer burden, we would rather tax the hospitals, send up money to the federal government, have them match that, and send more dollars back down to fund the program, so we at least get something for seeing the patients. So the hospitals have agreed to take any taxpayer burden so that it wouldn't come down to the citizens of Tennessee. Let's talk about politics for just 1 second. You've got federal politics and state politics. Federal politics is where all the discussion goes on about can the country afford to expand Medicaid and is it a right to have insurance and all that kind of stuff. That's a federal debate. At the state level, that's what this Medicaid expansion plan is. At the federal level, they have already allocated dollars to Medicaid expansion. That debate's over. You can talk about later if it's sustainable and all that kind of stuff. But the dollars have been allocated and they will be spent at the federal level, and they're going to be given to states that have expanded their Medicaid program. If your state has not expanded its Medicaid program, it doesn't get any of the dollars. They're going to be paid out regardless. So we're saying Tennessee might as well throw up our hand, participate in the Medicaid expansion plan, and get the dollars. And 2 years later, when it comes up again at the federal government level, voters can vote, people can debate, and they can decide, does it need to be continued and funded? At the state level, we say that if the federal government does not fund it anymore, then the plan goes away. And also, if the tax gets to be too burdensome on the hospitals, and at the end of 2 years we say we don't want to pay this anymore, then the plan goes away. So there's very limited risk for the taxpayers. It allows us to tap into the federal funds, which are already going to get paid out anyway, and it also allows a debate to occur in 2 years, and no one kind of gets in the way of it. To see if it needs to continue to be funded. So we kind of see it as a low-risk thing. Don't know if it's going to get through. There's a lot of opposition, even at the state level, from the Republicans. But you know, it kind of is what it is. So if anybody asks you about it, that's what it is. I can send you a lot of information. Some of it's kind of skewed and slanted, so you kind of have to read it with just understand the points that it's coming from. But if you have any questions, please let me know. All right, any questions about anything that I've said? All right, then I will turn it over to Amber.
So I'm realizing my fashion faux pas this morning. I have nowhere to put this. And about, I think 2 weeks ago, I had the conversation with Ace about my husband making a comment about my outfit. He says, you know, you kind of look like an Andes mint with those tights on because you have black and then the green. And Ace says, no, I think more like a mint Oreo. I was like, Oreos are round and some are double stuffed. So we're going to go with #thin mint, okay? So, all right. So Randy talked about New Year's resolutions, and next month, what holiday is it? Valentine's Day. So we are going to show our love to the community by doing a donation. So we have a slogan. It's Happy Valentine's Day, keep the flu away by washing your hands today. So we are going to ask our employees to donate just a small bottle of hand sanitizer, and you can bring it to HR. And then with those donations, we're going to distribute them to local classrooms throughout the community to cut down on germs and keep our kids healthy. So that's just a small way we can do that. And then for your donation, if you're a non-clinical personnel, that Friday, I think it's February the 13th, you can wear jeans and your Northcrest attire. And if you're clinical, you can deck yourself out in Valentine's print scrubs, so go for it. Okay, Randy also mentioned the employee satisfaction survey. So we took the employee satisfaction survey. We do that every 2 years, and we have changed partnerships the last 2 years. We have gone with the Work Institute. And the reason why we did that is for the results. In regards to the information that we receive, Press Ganey and Jackson satisfaction surveys are great surveys, but the information that we get from them is very stagnant. For instance, the question that asks, would you recommend Northcrest as a place to go for healing or for working? And if employees said yes, that's great, right? Great answer. But we never knew why. Well, why do they feel that way? Or if they said no, why? So the Work Institute, those of you who participated know that it's not just that one question, it's just 10 small questions, but after those questions, it began a series of the whats and the whys. So from that, we've been able to garner a lot more information of what we're doing really well and then things we need to improve upon. So the Work Institute came out and they discussed the overall results with Northcrest senior leadership. And then from there, we're going to cascade that information down to your departmental leaders. And they're actually going to have an instruction with the Work Institute about your own specific departmental results. From that, they will then cascade it down to you all in an action plan. And what that means is, just like Randy mentioned earlier, doing the stoplight reports, so that way two of the things that we saw that were prominent in the results as far as organizational wide were communication and also participation. So our participation this year was a little lower, and some of that could be because they didn't enjoy filling out the whats and the whys, but I wanted to reiterate again why we chose to go with that survey process. And then also with the information we received, communication. So just as Kim had mentioned, we have the Northcrest Weeklies, we have the Take Fives, we have town hall meetings. But when we got those results back, something that we did as senior leaders was to implement senior leading rounding immediately. So I'm sure you've seen some of this in your areas. I know that medical imaging, I got to experience that a couple months ago, and spent some time with Shelly hanging out in MRI and got to see how she fits everything in that little small tube. And so got to see all the images, and that was just fascinating. And then also got to spend some time with these ladies over here in case management and seeing how they might think that they have the plan of care all worked out, and all of a sudden there's something that changes. And so they are like wizards trying to put the pieces together and make sure that our patients get excellent quality care. Most recently, I spent my time in the OR, and I will confess that for the last 2 months, I've been dodging the OR. And the reason why I've been dodging the OR is because you all are the experts in your area. I am not. As a matter of fact, when I first started here at Northcrest as the recruiter, I passed out getting my blood drawn. So I am very scared of needles, don't like blood and guts and all that stuff, and that's why you all do what you do, and that's why I do what I do. But I appreciate y'all for doing that. So I went to the OR, and this is Amber's story time, so just enjoy. Okay, so I went to the OR, and I'm just excited to tell you about the different things I learned. So went to the OR, was supposed to spend about 2 hours with them, ended up spending about 5. At first I thought it was because they were being really gracious and they enjoyed having me there, but by the end of the time I think it was because they had a wager on who could get me to pass out quicker. So, but I made it, so. So some things that I learned. Number one, there is a height restriction in the OR. Did y'all know that? There is. Because when I put on my scrubs, they came right about to my calves. So you can only be 5 foot something. So put the scrubs on, and then we had another senior leader who came in, Kim. I won't speak to her pant issue. Not talking. I'm not saying anything. I'll let you share.
There's not a height restriction in OR.
What kind of problem did you have?
Okay, I didn't know how to put them on. Chrissy had to tell me. Got a straight face, and I have to admire this. She said, those are backwards.
I think it takes talent to be able to tie your pants backwards. So. So I put my mask on, and that was probably the hardest part because I didn't want to look like a newbie, because I heard about all that in senior admin, about how you're a newbie if your face, if your glasses fog up. So like, ear. So all of a sudden it's fogging up. I was like, oh my gosh. So I pinched my little nose part. I was like, I can't breathe. So I had to let some air conditioning in the bottom. So I made it through that. And I will say that I am not a doctor. I do not portray one on TV, and I did not sleep at a Holiday Inn last night. But Dr. Crozier is such an excellent physician, teaching physician, that I am fairly certain if you need your gallbladder taken out, I can do it. I know that the brown thing that looks like a tongue is the liver, and it does not like to be poked. So we're all good. And if you want to take it out, you just lasso it with the human version of a zip tie, and just lasso it and take it out. So after the gallbladder, Katie was able to show me, actually got me to hold it in my hand. I got to feel the little stones, so that was fascinating. And then after that, I watched a hernia, and I was like, what's that smell? I was like, 'cause I don't do well with smells. That smells like skin. It was. So got through that, and then went over and saw a skin graft. So saw that, and that's where Dave Wilkins said, I told him that I didn't want to be any cases with power tools. He says, well, you know we have power tools in this one. I was like, oh, I think I need to sit down again. So saw the skin graft, and they showed me how they make waffle skin. I will not eat waffles or fajitas for a long, long time. That's all I'm saying. So they showed me how they make the little waffle skin, and then they put it on the waffle wound, and I endured it. So I stayed upright, and they were very gracious, and I enjoyed every minute of it in every department that I've been. So I say all that to say that we have a genuine interest in what you all do. We appreciate each and every one of you. I appreciate each and every one of you, and appreciate that you're experts in your own area. But we want and we need your feedback. So when we're rounding in your areas, we want to hear about you. We want to hear about how's your day going, what you need, what's going well, what's not going well. And I will tell you that in each and every department that I have rounded in, there are no better employees. And patients could not come to a better place. You all do an excellent job. Thank you.
Whoa, big group. Okay, just one announcement. We have Amy Webster here from 8 to 11, Monday through Thursday, to see employees for free here in the building. Just to let you all know that. 8 to 11. What did I say? Yeah, 8 to 11. Monday through Thursday, 8 to 11. Okay, I want to talk to you for a few minutes about no pass zones. Up on the floors, we've initiated a new thing called no pass zones. That means when you walk up and down the halls, if there's a call light going off, you can't walk past it without stopping and asking the patient what they need. So poke your head in, hi, I'm Angie, what can I do for you? What we'd like to do is extend that to all clinical areas. And, same day surgery, wherever you're walking around, if you see a call light go off, whoever is walking by, stop and say, hello, my name is Jessica, how can I help you? I'll take care of that right now. You may not can do it, but you can get somebody that can help them with what they need. So let's extend that just a little bit further and say, okay, I work on the first floor and I never go up in the patient units. What can I do? Every time you see a visitor, you pass a visitor or a family member in the hall, how do you interact with them? Let's make that a no pass zone also. So in other words, let's implement the 10-foot, 10-second rule. If you're within 10 feet of me, in 10 seconds, I have to acknowledge you. Hello, how are you doing? They do it at Walmart, they do it at Publix. Go run into a worker at Publix and see how long it takes them to ask you if they can help you. Should we not offer the same customer service, if not better? Right? Let's extend that a little bit. One more step. What about to each other? If I pass within 10 foot of you, within 10 seconds, I'll acknowledge you. Because I'm one of the bad ones that walk around texting or emailing on my cell phone and I don't even look up and make eye contact, let alone speak to you. And that's my New Year's resolution, is that I'm going to stop that and I'm going to do better. So if we all make a conscious effort to do better and acknowledge each other, then it would be a better workplace, okay? And let's make that a no pass zone also. Yeah, I was telling the first group this morning, I kind of realized that when I took my teenage daughter to the mall with her boyfriend, and they were sitting on a bench in the middle of the mall, and I was watching them, and I walked over and said, "What are you all doing?" They were texting each other. Yeah. I didn't interrupt it because I thought, hey, that's safe. That's safe. But we do that also. So we need that human interaction. Okay? So let me look down my list here. Every employee has the ability to impact the patient experience. Okay? Now, town hall meetings. Town hall meetings are our way of communicating with you. We know kind of what to say in these things and kind of what you want to hear by the employee surveys, as was previously mentioned. So when you fill out your employee surveys, that's where we read those and we take those very seriously. So I want to thank you for all of you that filled those out. They provide us with some meaningful feedback and let us know how we can better do our jobs. Okay, so thank you for filling those out. I also talked about senior leaders are assigned to different departments. Well, I've got to work up there with Tyler and them for the first month. And I had a fantastic time.
I can imagine.
I did. And y'all, they do some stuff I never even dreamed goes on in this hospital, and I've been here for a long time. But what we go through just to get paid, it was absolutely fascinating and fabulous. I also got to spend some time in accounting and loved that experience also. This past month I was in lab with Ace and them, and yes, they kind of did bust me on my cell phone, but Coach was having a fabulous sale, but I promise I won't do it again. Okay? I swear I won't. But what I learned more about than just being in the departments was I got to interact with the people. And to me, that was the most meaningful part, is I got to know people that I normally don't get to see and I don't get to talk to. And I got to sit down and have one-on-one personal conversations with them and learn more about them. And to me, that was the most valuable experience I gained from that. So just to let you all know, I'm on switchboard next month.
Oh my gosh.
I'm serious. I don't know why everybody laughs when I say that, because y'all speak Southern too. But I'm doing switchboard.
I know how you did trying to film, so I can imagine when they call a code. I forgot.
See? And back to what Randy was saying about the CUSP teams and how anybody that wants to be a member of any team and make any decisions, we're going to be posting the CUSP teams, and that's how we make clinical decisions and we roll out initiatives. And I talked to them, and we would like to open that invitation to clinical leadership. Clinical leadership meets, and that's where all the coordinators and directors in the clinical areas come together, and we go through the policies and we approve those, and we kind of hammer them out and vet those out. And we would like to open that meeting and extend an invitation to anybody that wants to come join us. They're the third Fridays of the month, and they start at 11:30. Anyone that wants to come listen, come participate, you're welcome to. It's not a closed meeting, it's open. That's where we make the decisions, and you all need to be a part of the decision-making process if that's what you want. Okay? But there are staff member representation at the CUSP level, and then the CUSP teams bring those policies to clinical leadership. Okay? Just to let you know that.